The purposes of this study were to evaluate the volume and T2 signal change of uterine fibroid after using hormone therapy for MRgHIFU ablation, and to know the significant influencing factor. 127 fibroids in 60 women who were treated with MRgHIFU ablation after hormone therapy were retrospectively analyzed. Hormone therapy was performed in a standard manner, and 3-time injection was most common, but the number of injections ranged from 1 to 4 times based on patient condition. Fibroid volume and T2 signal intensity ratio were assessed in screening and treatment MRI, and perfusion MRI was performed in screening MRI, and these four parameters were calculated. Because we couldn't perform perfusion MRI on the treatment day, we assessed the changes in fibroid volume and T2 signal changes. And potential influencing factors are like this. We performed mixed model analysis considering the multiple fibroid in some patients. And in risk factor analysis, parameters with p-value less than 0.2 in univariable analysis were entered into multivariable analysis. This is the result. As expected, fibroid volume decreased significantly, and the average volume reduction ratio was 75%. This is a box-Whitaker curve plot that shows the general volume decrease. And this is a pairwise comparison, and you can see that only 10 cases out of 127 fibroids show volume increase after hormone therapy. This table shows the T2 signal change, and there was no significant difference, and actually the overall volume was almost the same before and after treatment with quite large variation. This is box-Whitaker plot, and this is a pairwise comparison, and you can see much more cases show T2 signal increase, which is about half of the cases. If we see the T2 signal change in more detail, 117 fibroids which underwent 2 or more times of hormone injection showed about 40 cases and 30% and 30% showed volume decrease, maintenance, and volume increase respectively, which is quite nonspecific and variable. In univariable analysis for volume change, these factors had a p-value less than 0.2, so entered into multivariable analysis. And in multivariable analysis, increasing number of hormone injection, higher T2 signal intensity ratio, and greater perfusion wash-in rate turned out to be independently significant. In univariable analysis of T2 signal change, no factor had a p-value less than 0.2, so multivariable analysis was not performed. In this 45-year-old female, this index fibroid had a quite low T2 signal intensity and intermediate wash-in rate. And after hormone therapy, volume decreased a little bit, but T2 signal intensity was almost the same. Treatment was done, and this part couldn't be treated due to depth. In this case, fibroid T2 signal intensity is relatively higher, and wash-in rate was lower than previous case. And after hormone therapy, the fibroid volume decreased a little bit, but T2 signal intensity increased quite much. And the size and T2 signal intensity of fibroid getting increased as ablation progressed. And treatment result was not very good. And in this case, fibroid is quite large and had a high T2 cell intensity and high wash-in rate. And after hormone therapy, volume decreased quite much to 60% of the original, but T2 cell intensity ratio was prominently increased to become a type 3 fibroid on the treatment day for unknown reason. So treatment was actually bad. So in conclusion, after hormone treatment of MRgHIFU ablation, uterine fibroid with higher T2 cell intensity and or great wash-in rate showed greater volume reduction, of which effect was strengthened with an increased number of hormone cycle. But T2 cell intensity of fibroid showed a variable and very non-specific changes after hormone. Thank you very much.
Any questions? Of course I have a question. Did you find in any of these patients when they came off of GnRH and after you treated them, did they have a higher regrowth rate? Were you able to follow them? So in the patients that you give the GnRH to, do you find their regrowth rate is higher than if you didn't give them the GnRH?
Actually, I didn't feel that.
Look at that
and most of patients underwent MRgHIFU ablation, so I didn't feel such.
You didn't see them coming back? And also there have been some reports in the literature that GnRH enhances the treatment, that it's easier to heat them up.
Yes.
Did you find any of these parameters, the sonication parameters, change with the GnRH?
Yes, actually, the reason why I analyzed the T2 signal intensity change is to see that phenomenon. So, and I feel in some cases, actually, the T2 signal intensity is lowered and the acoustic power to elevate to temperature is quite low compared to other user case. But some other case, as you saw in the graph, the changes are very non-specific. So in other case, T2 signal change didn't change, show any change or actually increased. So if I see T2 signal decrease, that the ablation was actually become easier.
Okay.
But it was in overall is variable.
So your sonication parameters did change with respect to T2 signal changes?
Yes, right, correct.
Okay, interesting. Okay, thank you. Thank you very much.